Hello everyone, my name is Hannah Holt, BSN RN, and today we're going to be discussing a lesson on hypertension. So first, let's go over some of the objectives or the goals that we want students to have completed at the end of this lesson. So first objective is students will be able to explain and describe systolic blood pressure and diastolic blood pressure and be able to correlate those with what's going on inside the heart. Second objective is students will be able to identify risk factors that are common for patients that develop hypertension. The third objective is to be able to describe some medical management for patients with hypertension. Specifically in this lesson today, we're going to discuss ACE inhibitors. And the last objective is students will be able to identify some lifestyle modifications to educate patients on to reduce their risk and prevent the risk of developing hypertension. Also, this lesson today on hypertension is designed for second semester adult nursing students. Second semester nursing students specifically because we want them to have an understanding of the fundamentals of patient care, but this lesson could be adapted to the general public just by changing some of the terminology. So this slide is going to discuss some readings and media that are recommended for students. The first is going to be a physiology book. This will go over the anatomy and physiology of the heart and how blood flows through the heart as a reminder for students. The second is going to be a pharmacotherapy textbook. This reading is going to go more in depth into medical management. It'll discuss the ACE inhibitors as well as other antihypertensives. And the third is a YouTube video. The link is posted. This YouTube video is a short clip, it's animated heart that goes over exactly what hypertension is and how each of those pressures are measured inside the heart and cardiac cycle. So what is blood pressure? What is hypertension? What do each of those numbers represent? So hypertension is high blood pressure. Most patients aren't going to understand the word hypertension, so correlating that with their understanding that hypertension is interchangeable with high blood pressure. What it means inside your heart is a long-term high force of your blood against the artery walls, and this long-term damage can cause some permanent damage. Hypertension is determined by the amount of blood and the amount of resistance that your blood flow in the arteries has to come against. Also, the more blood your heart has to pump and the narrower your arteries, the higher your blood pressure is going to be. So this slide gives you a visual representation of what our target numbers for blood pressure are. So in the green is our goal. It's normal blood pressure. Yellow is going to be elevated blood pressure. Red is going to be stage 1 hypertension and then stage 2 hypertension. And it breaks it down into each of the numbers, what each target level is. So first, what is systolic blood pressure? So the systolic blood pressure is going to be your top number when you get two numbers. For example, 120/80. Systolic blood pressure is going to be the 120. And what that represents is the pressure inside the heart during a contraction. And our goal is 120 or less. So the bottom number, 120/80, so the 80, is called your diastolic blood pressure. And that represents the pressure in your heart during a rest. And these are when your heart is resting in between beats. That's the pressure that it's measured, is the diastolic pressure. So next, this is a graphic about risk factors, and it identifies common risk factors. Some the patient will be able to change, some the patient will not be able to change, such as age and ethnicity. It also mentions smoking, diets that are high in salt intake, leading a sedentary lifestyle or not engaging in frequent physical activity, alcohol intake, high stress jobs or high stress lives, and then being overweight or obesity, all risk factors for developing hypertension. So this next slide discusses some of the pharmacological management for hypertension. So the first line of medications usually that will be prescribed are ACE inhibitors. ACE inhibitors stand for angiotensin converting enzyme inhibitors. That's where the ACE comes in. So the way that these medications work is they relax your veins and relax your arteries and allow for a lower blood pressure. So they block the conversion of angiotensin 1 to angiotensin 2. What angiotensin 2 does is angiotensin 2 narrows your blood vessels, also causing your blood pressure to increase and your heart to work harder. Examples of ACE inhibitors are captopril, enalapril, lisinopril. Any of those medications that have pril at the end are going to be your ACE inhibitors that are commonly prescribed to patients. So some side effects with ACE inhibitors. Also, as the note, ACE inhibitors cannot be taken with an ARB or with a direct renin inhibitor. Also, ACE inhibitors work more effectively in patients that are younger and also patients that are white versus older or Black populations. So common side effects. The number one side effect that patients will exhibit with ACE inhibitors is going to be a dry cough. Also signs of hyperkalemia, fatigue, dizziness. Dizziness usually occurs because of a rebound hypotension or low blood pressure, and then headaches. Also, considerations for prescribing an ACE inhibitor is that NSAIDs, if taken frequently or consistently, will lower your effectiveness of the ACE inhibitor. So a daily dose of NSAIDs or frequent doses of NSAIDs will decrease how the ACE inhibitor is working, so that should be considered. Also, they can be bad for pregnant women. They can be harmful to the baby, so that should also be considered if a patient is within that age range of becoming pregnant. So this next slide is going to link to the case study. So this would be where students break off into small groups and we'll discuss the case study, and the link is there. So this case study follows a 52-year-old woman who went to the dentist, and when they checked her blood pressure at the dentist, it was elevated, and she had never been told that before. So she's at her physician's office to evaluate for hypertension. She does have a history of a type 2 diabetic, also increased lipids. She has a family history of hypertension, and her blood pressure in the office during this visit was 155/90. Her other risk factors include she is a current smoker, and based on the weight that was listed in the case study, students would deduct that she is overweight as well and obese for her height. During the case study, students would come to the conclusion that the physician will prescribe an ACE inhibitor and would have to do some patient education on the new prescription and some lifestyle modifications, such as reducing smoking and increasing physical activity and lowering her weight. So this slide discusses some reflective journaling questions. Students would have an opportunity after the case study and after the lesson on hypertension to have reflective journaling time. So one of the questions that's listed: could I, as a student, have managed the case study in a different or better way? And if so, how? So students are working in groups. So this is their opportunity to list other options that the patient might have been able to have or to treat the patient better. So could they have been prescribed a different medication? Would it have been more effective? So this slide here is an example of a quiz question. So the completion of the lesson, students would have a quiz that has multiple choice options to reinforce their learning and ensure that knowledge was gained. So this is a select all that apply question that discusses the reducing risk aspect of preventing hypertension. So the answers are all correct. It's select all that apply with all options being correct. The first discusses reducing salt intake. The second is eating a healthy diet. The next one is avoiding harmful alcohol intake. The next one is increasing daily physical activity, managing an appropriate weight, and then avoiding tobacco products. And this is important now too, not just with smoking, but all tobacco products, including e-cigarettes or anything that has tobacco in it. And this is a list of references for this lesson that I used to develop this lesson plan that I would ask students for any questions and we would discuss. Thank you.